All right, guys, I welcome you back. I welcome you all to the channel, and today is the day 57 of recording daily scheduled videos for 75 days. And you've been watching all my series of videos. I really appreciate your attention span. You've got great listening skills, and one day watching all these boring lectures, right? All this boredom will be off and you'll reach one destination where you'll be proud of yourself. Okay? May God bless all of you and all your efforts. On that note, we start our today's video. And in today's video, we'll understand the deficiency specifically of iron. Okay? And our title of today's video itself is Iron Deficiency, a major nutritional problem worldwide. So let us understand. Iron deficiency is most widespread nutritional disorder, not just nationally, but globally, all right, throughout the world, affecting over 1.2 billion people, right? Not small amount. I repeat, 1.2 billion amount of people, and leading to iron deficiency anemia. We can also know it as IDA, and it is considered a public health challenge because of its high prevalence and persistent and serious consequence. Got it? So now we move on to the next topic of this iron deficiency and how is it caused, or what are the causes of mainly iron deficiency. First is inadequate dietary intake. Diets which are low in iron, specifically if I have to mention few diets like chicken, meat, fish, right, leafy greens, so we all must intake it in a adequate amount, all right, and if we fail to do so, then again it will lead to the iron deficiency. As a result, you'll be one among 1.2 billion people. All right, that's the and second point of the causes of iron deficiency is poor absorption, high consumption of phytates in cereals and tannins in tea, or for that matter coffee, reduces iron absorption. So uh, frequently having tea and coffee can also reduce your iron absorption, all right. And second, I just completed the second, and third is increased requirements, pregnancy, growth, scrubs in children, and menstruation raises iron needs. Therefore the people, specifically girls, right, who is having the menstrual cycle, right, and again women who are going through pregnancy, they must take a lot of iron contained foods, because this is the very time when they are in need of iron, all right, that's there. And now last causes of the iron deficiency is blood loss, chronic bleeding, example ulcers, heavy uh, menstruation, as I've said earlier, when girls and women are in their menstrual cycle, right? They must intake a lot of iron, foods or diet that is rich in iron, and right when there's a lot of bleeding, right, like ulcers and all, you must take a lot of iron rich foods, all right. So last cause, this was the last cause, where when there is chronic bleeding, there's high risks of iron deficiency. That's there. Now let us look into the impact of iron deficiency. What will it cause? What will be the effect aftermath? So first is anemia, fatigue, weakness, and polar and dizziness. Second is cognitive impairment, reduced concentration of your brain and mind, learning difficulties in children. So it's very important for your studies, for your academics, right? If you lack iron, right, then you might see a lot of, you know, your mind, your brain getting distracted or failing to learn the lesson quickly, right? Therefore, iron becomes very important when it comes to learning. And if you are aspirant, if you are a student whose ambition or goal is to clear the paper, or for that matter pass the examination with good grades, right, then you must focus on the well iron content foods, like as I've mentioned, green leafy vegetables, right, meat, right, milk, or for that matter you can google, you'll get plenty of the diet chart, right? So yeah, just make sure you consume, right, you consume, your food consumption must be iron rich foods, right? And you must orient yourself with the all sort of food which are rich in iron, okay? And in that way you will learn things, right, you will retain, and it will be easy for you to retrieve the things once it's done. All right, that's there. And third effect of the iron deficiency is immunity. It increased, you know you are very prone to infection and all right, so you must take a lot of iron. And last is maternal and child health care. High risks of premature birth, low birth weight, and maternal mortality. So we can often see a lot of babies, right, newborn babies with very less weight, and it's all because of iron, it's all because of deficiency in iron. So that's there, and these are all the effects when you are under iron deficiency. That's the Now let us understand its global significance. Iron deficiency is one of the three major micronutrient deficiency worldwide, alongside iodine and vitamin A. Next, the disproportionality affects women of reproductive age, and for that matter also the women who are going through menstrual cycle, and moreover infants, right, children, and also adolescents, mainly the youth age, okay? And especially in underdeveloped countries, and in addition also the developing countries, and in a very less scale we can also see it in developed countries. That's there. Now let us look into the optimistic aspect of our today's video. Now let us see what are the prevention and control of iron deficiency. First is dietary diversified. So you must diversify your diet plan, which includes iron-rich foods like meat, beans, green leafy vegetables, spinach, right, and a lot of cereals if it's possible for you to get cereals, right, or for that matter you can also order it online through, you have a lot of websites, right, so you can order cereals, right? And green leafy vegetables you can just go to village, right, or now you all get those in mandis and all, where it comes directly from the village, right? So make sure you take good food without any preservatives, right? For that matter, any what do you call it? Specifically, food which are very organic, right? Where there is pure, animal manure, which has been used to grow that crop, right? Specifically, organic, genuine organic vegetables will help you a lot to overcome this iron deficiency. Now, next is fortification, adding iron to stable foods like flour or rice. That's great. Now, third is supplementation, iron tablets or syrups for high risk groups, specifically, again, pregnant women and children, and also the girls who are going through menstrual cycle. That's there. And last is public health measures, control of parasitic infection, improved sanitation, and nutrition education about iron deficiency. That's there. That was all the prevention and control of the iron deficiency. Now, in summation, iron deficiency isn't just about the fatigue. It's more about silently undermining productivity, learning, and maternal child health. As I've mentioned before, right, your learning is diametrically connected to the food you consume, right? Although there's another side to it, right? Because I've seen the guys, who don't know what a real diet looks like, clearing, toughest exam of all time like UPSC, SSC, right? But in order to stay in a safe side, right, if you can afford, you can have a lot of iron rich food, right, which will help you to memorize things quickly and retain and retrieve in the examination hall, right? So it's better if you can afford it, right? You must consume a lot of iron rich foods for your preparation. It could be anything, school exam, right? Competitive exam, or in general, if you want to stay, you know, active, right? If you want to keep your brain and mind active, right? You can just, consume a lot of iron rich foods. That's there. Okay, guys, that's enough for the day. And yeah, let us just end our today's video. There's one viewer. I really appreciate your attention span. And may God bless all of you and all your efforts. Time to end this video. Join the and Jai Bharat, guys. Let's go and kill. There's one viewer. Thank you so much. I really appreciate it. Okay, guys. Bye bye. Time to end the stream. Again, may God bless all of you and all your sincere efforts. Joined.